Hello, everybody. Welcome to LACER's open enrollment Zoom meeting on Anthem Blue Cross. Thank you so much for joining us. I know it's a little bit different this year. No big in-person presentations and big raffle prizes and nice breakfast, but you've got us, and that's all that really matters, right? All right, so we're here to talk to you about what you can expect in plan year 2021, give you some updates on your benefits, as well as hear from Anthem. And then you'll have a question and answer session where you can ask whatever question you have on your mind. And then we'll also tell you a little bit about our Laces Well program, what's happening there, and ways that you can participate to enhance your retirement experience. So in case you don't know who I am, I'm Alex Rabrenovich. I oversee Lacer's Health Benefits and Wellness Division, and welcome. Well, let's get started, shall we? All right, so open enrollment. What is open enrollment and why do we do it? So open enrollment is the time of year where you can enroll in a plan, change plans, or add a dependent to your plan. And this is typically done once a year. Usually we do it from October 15th to November 15th. And during that 1 month period, you submit your enrollment forms, your requests, and we process them and get them effective for the new plan year, effective January 1. But this year is different in so many ways, right? But Lacers is no different than the rest of the world right now, I guess, in having a lot of changes. So just so you know, we've extended open enrollment. It's going to now be from October 15th to March 31st. And that is only for this year, mind you. So again, we're extending open enrollment to March 31st. And that's going to give you more time to think about your plan options to really, make more informed decisions. However, there are going to be some restrictions associated with that. But before I get into those restrictions, I want to explain why we're extending open enrollment. It sounds like a good thing, and it is, but the real reason why we're offering this extension this year is because of the pandemic. As you know, many organizations and businesses are suffering economically due to the pandemic. The city of LA is no different. They're dealing with some fiscal challenges right now, so they're looking for ways to save money. And one of the things that they are doing is offering a retirement incentive program for those employees that are already eligible to retire, but haven't retired yet. So they put out this opportunity, and nearly 1,400 people responded and signed up for retirement. So Lacers has the great challenge of retiring about 1,400 people over the next few months. This is a big undertaking. Basically, our workload is tripling for the next several months. So we were trying to find a way to sort of dampen the impact of open enrollment, because that tends to increase our workload significantly during the 1 month period and beyond while we process all the requests. And so we thought, well, maybe if we extend open enrollment, people's requests will trickle in instead of all of them coming in one concentrated month period. And that will not have as dramatic an impact on our workload, which is already being significantly impacted by the incentive program. So that's why we're extending it. And because of that, there are some restrictions that I want you to understand because they are really important. Again, this is not our typical open enrollment. So I'm going to go over those. And if you have any questions about them during the question and answer period, please be sure to ask. We want you to be completely comfortable with your knowledge regarding this. All right, so the restrictions. Well, we will have up to 3 months to process your request. So if we receive your request in, let's say, January, we will do our very best to process it right away. But given the workload, we wanted to give ourselves enough room to manage all the all the work that has to be done. And so we will have up to 3 months. So if we receive it in January, it may not get processed till February, March, April, which means your change will be effective May 1st of 2021. Again, we're going to do our best to process the requests as soon as possible. And we know some people are without coverage. And so we'll give people, we'll give those people priority. But do know that if you're already enrolled in the LACERS plan, your coverage is going to continue until the change takes effect. We're not going to stop coverage and then pick it up 3 months later. So please feel assured that you will continue your LACERS coverage. Now, you can only make one change during this extended open enrollment period. So if you submit your change right away, let's say you go ahead and fill out your forms, submit them in November, we're able to process it by January. But then come March, you're like, I don't like this change. I want to go back to the plan I had before. You cannot do that. Whatever change you make during open enrollment has to stick. You're locked in with that change for at least 1 year. Okay. And the reason that we have that 1 year limitation is that the carriers, when they're coming up with their premiums, they're looking ahead, they're projecting the upcoming year, the utilization that they expect to see, the costs that they expect to have, and they develop the premiums based on that. So all of our annual premiums are supposed to cover that. And so it's really important that people stay in a plan for at least a year, which is probably why we have open enrollment once a year. Anyhow, so again, unless you have a qualifying event, like you move to a location where your plan isn't available, or you have a family status change and you want to add a dependent, unless you have something like that, you're not going to be able to make a change for at least a year. And what that means really is if your change takes effect, let's say in February, then you wouldn't be able to make another change till at least February next year. Well, you can't just make a change at any time. It has to be during open enrollment. So then you would actually have to wait until the following open enrollment. So again, if your plan takes effect February 2021, you have to wait till at least February 2022 to make a change. And unless you have a qualifying event, you're not going to be able to make that change till October during our open enrollment period for 2023. And your new change won't take effect until January 1, 2023. So I know that can get really confusing, but basically it comes down to this. If your change takes effect after January 1, 2022, if your change, it's confusing to me too. If your change doesn't take effect until after January 2021, then you're not going to be able to make another change until open enrollment in 2022 for plan year 2023. Okay, it's probably confusing, but again, hit us up in the question answer period. Hopefully I got through to some of you on that. I confused myself there a little bit. Okay, the other thing is if you retire during the open enrollment period, again, we're having a lot of people retire over the next several months. So a lot of people are going to be retiring during this open enrollment period. And if you did retire during this open enrollment period, whatever plan selection you made at retirement, you have to keep. You cannot change it during this open enrollment period. So if you retired and selected Kaiser, let's say, but you see that it's still open enrollment and you want to change to Anthem, you can't do that. You have to wait until next year's open enrollment to make a change. So if you retired, you can make a change in open enrollment of 2021 for plan year 2022. Okay. I'm sure I'll hear questions in the question and answer period. So please, 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 I want to make sure everybody's clear on this. All right, health plan renewals. Let's move on to some more simple topics and really good news on this front. So, the last few years we've had amazing renewals with barely any increase, and that's no different for 2021. Overall, our health plan premiums for medical, dental, and vision are increasing at less than 1%. I mean, very, very, very little. And even with no increase, we're actually able to add some new benefits and programs. So very excited about that. You're going to hear more about that later. In terms of premiums for Anthem, there are some slight increases. So let me tell you about those right now. So for the Anthem HMO plan, the single party premium is going to be $1,069.58 for single party coverage and $2,134.13 for two party coverage. For the PPO plan, the new premium is going to be $1,279.79 for single party and $2,554.55 for two party. And for the Medicare supplement plan, excuse me, for the single party premium, it's going to be $564.92. And for two party coverage, it will be $1,124.81. Of course, many of you don't pay that amount. You do get coverage by your medical subsidy based on your years of service. So why don't we go ahead and talk about the medical subsidy now? Okay, so for 2021, the maximum medical subsidy is going to remain the same at $1,790.80 a month, which is really good, I think. And in case you're unaware of how the board comes to decide on the maximum subsidy, the board only has the authority to increase the maximum subsidy by the amount of increase in the Kaiser Permanente HMO non-Medicare two-party premium. So if the Kaiser HMO premium for two-party coverage increases by $100, the board can only increase the maximum subsidy by $100. The Kaiser premium is staying flat for next year. There's no change. So the maximum subsidy will also stay the same. And if you're participating in the medical premium reimbursement program, this will also continue as the maximum reimbursement amount. Regarding dental subsidies, the maximum subsidy will also remain the same at $44.60. Again, the board only has the authority to increase the maximum subsidy by the amount of increase that the personnel department has for the employees, for the active members. They did not increase their dental subsidy, so the LACES board cannot increase ours. It does cover most of the premium for the dental PPO plan. There is a little bit of a deduction, but for the HMO plan, we are able to cover the full premium if you get the maximum. Okay, talking about new programs and benefits. So the one good thing I'm really happy to report is that for the Anthem PPO and Medicare supplement plans, there is no more lifetime maximums. These are the only two plans that had lifetime maximums. I'm really happy to report we were able to negotiate those away. And basically what these are thresholds where over your whole time in that plan, you cannot surpass a certain threshold in terms of cost. And that threshold was $2 million. Once you hit $2 million, they could no longer cover you. So we removed that. So now there's no concern about loss of coverage. But to be fair, I don't know of anybody that's ever reached that $2 million mark. So I think people are pretty safe, but just knowing that there is no lifetime maximum, to me, I know it's my mind at rest. I'm sure it does the same for you if you're enrolled in those plans. And again, none of our other plans have a lifetime maximum. For the Medicare supplement plan, excuse me, there is an increase in the supply of generic prescription drugs, and Anthem will talk about that. And there are a couple really good apps available to you. The Sydney app, which helps you access important healthcare information, and telehealth that provides you the ability to have an appointment with your doctor through through video, similar to this, and that's going to be covered the same as office visits. And again, Anthem is likely to cover all of that in their presentation. Lacer's Well, one of my favorite topics. It's our wellness program. We've been working at it for the last several years, and we've really seen it grow and take off. We have all kinds of educational events, newsletters, fun activities. We have a group of wellness champions who are our retired members that lead activities in their own communities for our other Lacers members. And so if you've never taken part, we hope that you'll consider joining our program. We have a lot of fun. You meet a lot of neat people, and there's just, and we want your input and feedback too. But later on, Stephanie Smith and Crystal Baldwin will tell you more about our program and what's happening there. And just know our ultimate goal is really to just help you have the best retirement possible. And then I want to cover some reminders. If you're planning on moving in the future, please keep in mind that your plan may not be available in your new zip code. We've had situations where members have moved to a new location within the same state even, and they assumed that their plan was going to be available in their new place of residence, but unfortunately it wasn't. And their only Lacers option was a more expensive plan, which they were not happy about, and understandably so. But it is important just to make sure that your health care is part of the consideration when deciding where to move. And so if you have if you're considering that at all, please call Lacers. We'll be more than happy to help you understand your options. Now, if you are changing plans, make sure that if you have any prescriptions, that you get them filled before your effective date, just so you have some on hand through that transition period. You never know, there might be some kind of issue in your information being uploaded into the system. I'm just gonna take a sip of water real quick. Please hold on. All right, sorry about that. Back to prescription drugs. So yes, so please make sure you get a refill before your effective date, just in case there's any issue with getting your information uploaded into the system of the new plan. We want to make sure you have all your prescriptions on hand to get you through that transition period. It's unlikely that there will be that kind of a problem, but just in case, better safe than sorry. All right. Now, if you are going to change plans and you know that your doctor accepts your new plan, make sure that they're accepting new patients as well. Doctors may accept an insurance plan, but they may not be accepting new patients. And if you really want to keep your doctor, you need to have a conversation with them first to make sure that that's the case, because nothing I hate more than people that make changes and they're not getting what they want and they're not getting what they expect. And, I don't want that to happen to anybody. I want you to be really happy with your choices. So be sure to verify with your doctor that they are accepting new patients. And then if you will be turning 65 soon, we do have a Medicare requirement. You must enroll in Medicare Part B, pay for that out of pocket, or if you receive Social Security, they will withdraw that they will deduct that from your Social Security check. And if you're eligible for Medicare Part A at no cost, you must enroll in Medicare Part A as well. If you are enrolled in both Medicare Part A and B, you will be reimbursed the cost of your Medicare Part B basic premium. Okay, it's really important that I'm sorry, I've got a frog in my throat. Okay, there, now I'm back. All right, if it's not technical issues, it's throat issues. All right, so if you have a new address, a new phone number or email address, we want to make sure that Lacers has that on hand so that we can contact you with any important information. So please, please, please keep us updated with any changes in your contact information. There's a change of address form on our website, and you can provide us your new information through that form. Make sure you review your beneficiaries, and if you need to add or change them, there's a designation of beneficiary form on our website as well. And I always like to take the time to remind people about powers of attorney. It's always good to have a power of attorney in place, especially for your health benefits, in case you are unable to make decisions on your own. Things happen all the time, things that we don't expect. So just to have somebody there to make decisions, that somebody you trust to make decisions on your behalf, is really important. And so you can find a form on our website related to power of attorney as well. And I will show you our website in a bit. All right, so open enrollment meetings. We already had our Kaiser meeting. Today we're having our Anthem Blue Cross meeting, and you can see the list of upcoming meetings with the different carriers. You can go ahead and register through My Lacers if you'd like to attend any of those. You can also call us and we'll register you for them. And if you miss a meeting, don't worry, we're recording them. They are going to be placed on our website for future reference, just in case seeing us once isn't enough, right? You might want to revisit. All right, so as I mentioned, everything you need to know is at www.lacers.org, and I am going to quickly take you there and show you how to access all the information. So hold on one moment. Okay. Oops. Ah, there we go. Okay, so this is our Lacers website. If you haven't been here for a long time, you might notice that it's changed. We have done some updates recently. If you've never been to it, welcome. There's a lot of great information to be found here. So I mentioned some different forms. You can find them very easily on our website. If you just go along the top here, we've got forms and info sheets. Click on that. And here you go. You can find your change of address form. If you're filing a domestic partnership, we've got those. Your health forms, so to make your dental plan enrollments or medical or dental plan enrollments, counseling a plan, making if there's a family account change, you've got the forms that you need right there. Various information sheets. Here we've got some information and forms for power of attorney. Again, take some time to look these over and make sure, if there's any changes that you need, that you complete the appropriate form and submit those. And now regarding health plans and open enrollment, if you go to the retiree tab right there, you can click on that. Give it a moment. Click on retiree health benefits right there at the top. And you'll have a whole list of options. And here we've got open enrollment. You can click on that. And there's a video you can watch, basically covering what I covered at the beginning of the presentation. You can find the overview that was included in your packet right here, the benefits guide right here. Some FAQs to help you understand some of the restrictions that we have for this year's unique open enrollment period, all of our upcoming meetings. And then this is really important here. We've got the health plan carrier benefits and plans. And so if you click here, each carrier provides us all sorts of information about special programs and what they have to offer to help you, review and decide what your, what health plan decision you might want to make. So for Anthem Blue Cross, we've got that right here. Then we've got Anthem Blueview, Delta Dental, Kaiser, Scan, United. So they're all there for you. So really, there are a lot of resources here to help you make your health plan decisions, and also just to understand the plan that you currently have if you're not even making any changes. So please visit. Again, a lot of great information for you. www.lacers.org. A lot of great information. That is the end of my presentation. Thank you very much for listening. Again, if you have any questions, hit us up during the question and answer session, and I will move it on to the next phase of this presentation. Thank you again for joining us. Have a great day.
Hi, good morning, everyone. I'm Stephanie Smith with the Lacers Well program. We have a video we want to play for you that talks about some wonderful programs available to you as a Lacers Well member. But before we get to that video, I wanted to share some information about virtual activities that we're working on for you. The holidays are coming up, and we know it can be a difficult time, especially for those that may have lost or are missing their loved ones, or just have a difficult time with loneliness during the holidays. On November 18th, we will conduct a holiday wellness workshop. So check your email from Lacers to register for that holiday wellness workshop, and be sure to check our website periodically to stay informed about upcoming wellness events. If you're not getting emails from Lacers, please check your spam folders, because we have had members that have not received said that they have not received emails from Lacers, so be sure to check your spam folder. We do look forward to seeing you at the next virtual wellness event. So now I'll turn it over to Crystal, and she'll share some information about our champion program. Crystal?
Hey everyone, it's so good to see you all today. As she stated, my name is Crystal Baldwin with the Lacers Well program, and I am responsible for recruiting retired members to lead champion activities. We offer such activities as walks on the beach, walks in the park, walks at the mall, museum tours, hikes, bike riding. We have champions that lead cooking classes and different activities. However, when the pandemic hit, we had to cut and stop a lot of those outdoor activities, and we had to go virtual and do other things. And spearheaded by Stephanie Smith, we started a volunteer phone bank. And this particular phone bank is currently still in operation. We have champions that actually reach out to our older retiree population to check on them, to provide them with any resource information during this time of need and being at home, and as they look forward to being safer. We've also partnered with an organization called Element 3, and they will assist us with facilitating our virtual activities, such as the virtual book club, movie reviews, scavenger hunts, and we're also will be putting on a holiday social gathering as well with them. So we have so many activities to offer, and we definitely would like to open it up to you. If you have a hobby, something that you like to do in your spare time, that you wouldn't mind sharing with the rest of us, we would want you to sign up to be a champion as well. So I'm going to turn it back over to Stephanie at this time, and she's going to play a more detailed video at this time. Take it away, Stephanie.
Thank you, Crystal. I'm going to share my screen now and bring up the video.
My name is Alex Rabrenovich. I oversee the Health Benefits and Wellness Division at Lacers. Lacers Well is part of that division, and so I, along with Stephanie Smith and Crystal Baldwin, plan and strategize to bring wellness opportunities to our retirees.
My name is Stephanie Smith, and I'm a wellness program manager with the Lacers Well program. And my role is to oversee the daily operations of the wellness program.
This is Crystal Baldwin, and I am the Lacers Well Champion Coordinator. And my role as the Champion Coordinator is to recruit Lacers retired members to the Champion program.
So over the last few years, we've really come to realize what we want to achieve with our wellness program. Initially, we wanted to educate people about avoiding chronic conditions and staying physically active and eating well. But we realized people already know about that. People hear about that from their medical providers, from their friends, on the TV. And as we started doing more research on wellness, we realized that there's a lot more to well-being. There's a lot more different factors that play into somebody feeling well and being well. So there are 5 components to overall well-being. One is purpose, there's health, mental and physical, financial well-being, social engagement, and community. And we realize that purpose is a real driver. If you have a sense of purpose, you want to get up in the morning, you want to be well, you want to live. If you don't have a sense of purpose, you might not be willing to take care of yourself, because what's the point? Why am I here? Why should I do anything? And so we really wanted to start to work more with that in mind, sort of building a sense of purpose in people's lives and also giving them opportunities to expand their experiences in the other areas of well-being. Last year we did something called the Purposeful Living Workshop. It was a 5-session workshop that focused on each component of purposeful living. Again, that's purpose, health, financial wellness, community, and social engagement. We're really fortunate in that we have a good partnership with the Department of Aging with the City of Los Angeles, and they let us know about a program called Aging Mastery Program that's sponsored by the National Council on Aging. And it's a 10-session program that covers the same areas. I mean, it's not specifically titled the way we titled our sessions in the workshop, but it covers all the same areas, and it's a fantastic program, and we're so happy to be able to bring that to our members. And so that's something that we're just starting this year, and I know people are going to love it. And we look forward to other workshops that we can bring in the future, but this is really an opportunity for people to really sit down, examine their lives, examine their goals, and set up a plan to achieve their goals. So we're really fortunate again to have a partnership with Mom's Computer. It's a small company, but a very passionate group of people that really want to help seniors with technology. They have joined us at some of our events to help members with any questions that they had about how to use their smartphone, their laptops, their tablets, and they were a raving success. People were coming to our events with their equipment, sitting with them, getting advice, and the more feedback we got from people, the more we realized they really needed this help. And so we've taken it a step further, and now we have them on retainer so that not only are they at all of our events and helping us with our virtual sessions, but also they're available to members anytime. If they have a question, they have a problem, they need help, they can just reach out and call them and get assistance. So a couple years ago, we started what we call our volunteer picnic. It's an opportunity for people to come together, have a good time, be outside, have live music, eat a nice lunch, but also there's a volunteer component to it. We invite various volunteer organizations to come and set up booths so that members can then walk around and get to see the different opportunities that they have to volunteer in their community and give back and engage with their community. Again, that supports that whole purposeful living campaign. So we have a gala at the end of every year, or I guess at the beginning, depending, but basically it's a way to celebrate the year that just passed. It's a big party basically for everybody that participated in our program. We have dancing, we have food, we have performances, we have prizes. People love it. And it's funny because I think people have an image in their head of what seniors are like and retirees, and you don't think they're going to get down. They were on the floor dancing, doing all kinds of dances that I didn't even know existed. And these are current dances, okay? So I was out there with them too, having a good time. And I'll tell you, the next year it happened again. And then unfortunately, because of some budget issues, we couldn't do it the following year. And people were upset. They want to dance. So we're going to be coming back with a big dance party and celebrate again. So that's probably my favorite thing that we do. It's just about having fun, social engagement, community. Love it. So we started a Facebook page not that long ago. And really, it's a way for members to connect, see what's happening online. Some people are more remote than others. They don't necessarily have the ability to come to all of our events. Maybe they don't really come to our website, but they are on Facebook. So, they can check in on our Facebook page, see what we have coming up. There's a lot of good information, wellness-related information that we post, videos, articles. And again, it's a way for people to connect with each other and, just stay in touch and support wellness. So our wellness newsletter is called Your Health Matters, and it's focused on the topic of wellness, also focused on our 5 principles of well-being. So it's really just a way to encourage members to continue thinking about and engaging in those 5 elements of well-being. Also, it connects them to the different resources available through our health plan carriers and lets them know about upcoming events. It's a way for them to stay informed and stay engaged. On the Lacers Well page, you can learn about different activities. You can register for upcoming events. If you've participated in our events, again, you can earn points through our Passport to Health program. So you can go ahead and log those points on our website. There's a calendar that shows all of the upcoming events. So if you're not sure what you might want to do next month, you can look and there you go. You have some options there. It's really a great way to stay connected. So with the pandemic of 2019 and 2020, we've had to really make a big change. We had so much focus on in-person gatherings because to us the social connection is so important. And we couldn't do that anymore. So we didn't know what the next step was going to be. Although we know there are different ways that you can connect virtually, such as through Skype or FaceTime or Zoom. We weren't there yet as an organization, but we had to move quickly because we wanted to continue having offerings for people. We wanted to make sure the momentum continued with those engaged members, and we wanted to also attract and bring in more members. So we quickly switched over to virtual offerings. It was a little bit of a quick bumpy road to get there, but we got there fast, and you know what? The members loved it. We had so much response to our first virtual event. We did a really great financial resilience workshop. It was a 3-session workshop, and we had huge attendance and people from out of state and even out of country that registered, and that wouldn't have been possible before. And so it's really opened up the door to so many more of our members, and we're so happy we finally made it to this place where we can actually connect with people virtually. And again, it might not be something some of our retired members are really familiar with or comfortable with, but we do have that wonderful support of Mom's Computer. So if anybody out there really wants to join, but they're not sure how to participate in a virtual event, we have Mom's Computer there to help them. So excited about this program. It's really grown a lot in the last few years, and we've got an amazing committed team. It's a small but mighty team that really pushes this wellness program forward. We talk a lot about purposeful living for our members, but I think for us, it also provides purpose. We really just want people to have the best retirement possible, and knowing that we're helping people achieve that not only feels good for us, but I know the members also appreciate it as well. And I just can't wait to see where it goes in the future.
Wow, what a wonderful video. Let's give it up to Alex. He deserves a virtual hand clap. That was a beautiful video. It summed up the program in a nutshell for what the Lacers Well team is all about and what we're doing. So at this time, I would like to introduce someone that I've had the pleasure with meeting, and the Lacers team has the pleasure with working with her through the years. And I see there are quite a few questions in the chat, and just we're definitely going to get to your questions. There's quite a few, but we truly had a pleasure of working with Maggie Foster from Anthem Blue Cross in our in-person events. Her and some of her team members are on the Zoom today to present to you and give to you the information that you all are here to hear and listen and get from her with regards to Anthem Blue Cross. At this time, I'm turning it over to you, Maggie Foster, at this time.
And Crystal, thank you for that introduction. And Alex, you are the bomb. So, with that said, I'm Maggie, and I'm going to be walking you through the Anthem plan today. Our goal is, we know you have a number of different plans to choose from. So my goal is to help you understand the Anthem plan so that you can choose what's right for you. With that said, before you choose a plan, you want to consider the 3 C's. Consider, compare, check, and cost. So number 1, consider your personal situation. Have your health needs changed? Do you want to look for benefits that fit your needs? Compare. You want to compare the costs such as deductibles, coinsurance, copays, and out-of-pocket. Third, you want to check to see if your doctors, hospitals, and other healthcare professionals are covered in the plan. And fourth, you want to choose the right plan for your needs. Why Anthem? Just to give you a little bit of background on Anthem, Anthem is one of the largest, one of the nation's largest health insurers. We've been in business for over 75 years. Our network is more than 96% of the hospitals and over 92% of doctors in the US today. And Anthem is dedicated to helping you live a healthier lifestyle. So some of the discussion topics we're going to talk about today are the Anthem medical plans. As Alex had alluded to, all of these go into detail on the Lacers website. So I'm just going to touch high level. So we're going to talk about some of the wellness plans, the Silver Sneakers, BioBlue, and some other tools. So with that said, Lacers has 3 plans that are offered under Anthem. One is the members under age 65 with the Medicare Part B. We have the HMO and the PPO plans. For our members with the age 65 and older with Medicare Part A and B, we offer the Anthem's Medicare Supplement Plan. And we also have our PPO plan that's covered out of California, out of the country, and its territories. So Alex took my thunder on this because he alluded to some of these things right here. With the lifetime maximum that was removed, that's an awesome, awesome detail. So you did have a 2 million lifetime maximum that was removed, and the Medicare prescription drug did increase the supply limit from 90 to 100 days. Our Sydney Health app, this is an awesome tool that it allows you to gather all your information in one place. This is an app you can download on your mobile device. You'll never have to carry an ID card again. You can view your ID card, your medical claims. You can even chat with a live doctor through the video portion of it. We also have the Silver Sneakers that we offer to all of our Lacers members with a number of on-demand classes right now due to the COVID situation. And we have our telehealth visits that are covered the same as all COVID visits are free, and the rest are covered as in-network doctors. Moving on, I added a number of COVID tools here that I thought were useful. These, again, you will find on the Lacer site. So I won't go into detail. So I'm sure a number of you have seen these already, unless you want me to, Alex. I think you've had the flyers out there for quite some time. I can't hear you, Alex.
If you just wanted to touch upon them super quick.
Okay.
Just
So if I can quit switching the thing. The test, the COVID test center, that is, you can put your zip code in there and it'll bring up centers within your area. There's numerous of in each zip code. The assess your symptoms, that's our Sydney Care tool. That's another free tool you can download on your mobile device. And it asks you 5 simple questions. And if any of the questions appear that you need care, it'll transfer you directly to a provider. Our Psych Hub we partner with some of the nation's most credible mental health organizations. Should you need help through this difficult time right now. And then with our Life Health Online, you can see the doctor or a psychiatrist or therapist through your mobile device. My favorite part, honestly, my favorite one is the Aunt Bertha. With Aunt Bertha, you put in your zip code, you log onto there, you put in your zip code, and it brings up thousands of opportunities and resources within your area. It's an excellent tool you can find transportation, food, care, legal, housing, etc. It's an absolutely amazing tool. Now I'm going to walk you through some of our Anthem programs that we have. Our condition care program is a program that you may have heard. If you have lower back pain, vascular disease, or musculoskeletal, you can call a nurse care manager 24 hours, 7 days a week for this program. It's absolutely free to you, and the program is backed by a team of pharmacists, dietitians, and exercise specialists. You'll get help in managing your condition and following your doctor's care. Touch points may be that you will include outreach, telephonic outreach, mailing, and online tools. With our Health Advantage tool, this tool looks at you've gone to a provider and claims will come through, and this may trigger a gap in some gaps in your care. So we look at that to see if there's ways to improve your health and suggest different ways that you can avoid serious health problems. With this program, if you're identified, you can receive reminders in the mail about screenings and tests and other programs to help you to stay healthy and save you cost-saving trips for expensive health expenses. Our 24/7 nurse line is available 365, 7 days a week, 24 hours a day at no cost to you. And this is staffed by registered nurses to talk to you about your general health. They can determine whether you need, you can treat yourself at home, if you need to call 911, if you need to go to an urgent care or the emergency room. And they have a complete library of anything that should pertain to you on any illness or disease that you'd like to talk about. It's a great resource. Oops. So getting people connected, this is our Life Health Online. My slides are out of order, I apologize. This is our Life Health Online, where you can speak with a psychiatrist or a therapist. You can see a licensed therapist. Appointments are available 7 days a week and usually for a 45-minute session. You can also see a psychiatrist online, and psychiatrists are available to evaluate and medication management also to help if you're coping with a common behavioral disease condition. We also have our Blueview Vision. This is one of our top-rated Blueview Visions. It's available to all of our LACERS members. And I know our vision rep she's gonna talk about this on, I believe it's November 9th. So you'll get more information on this. I just wanted to remind everybody and bring it to everybody's attention. It's a great, it's an absolutely great vision program. And here are some of the retailers that you may know. You have Lens Crafters, 1-800-CONTACTS, Contacts Direct, Pearl Vision, Optical, and independent providers. So with our Silver Sneakers program, I'm sure a number of you, because you all like to dance and get out there and exercise, this is offered to all of our Lacers members and their dependents. And during this time of COVID and the way our world is right now, we're offering a number of live classes and much more via Zoom. These are full-length live classes, and they're taught in real time by our national trainers. And you can sign up and log on to any of the classes by logging into the Silver Sneakers website or calling the number on the card. I mean on the card on the slide. Sorry. So another. This part, I'm going to go through a couple tools that will help you for anybody that's new and looking to come onto the plan. We have our Find Our Doctor tool. So we've made it easy to go onto this website, and you can look for doctor. You put in your zip code. If you're not a member right now, you can sign up. You can go on the website and sign up as a guest and put in your zip code, and you can look for doctors, hospitals, labs. You can also check doctors' profiles. You can look up acupuncturists, chiropractors, a number of different doctors. It's a Next is our Sydney Health, and if you're an Anthem member already and you've logged on to anthem.com and you have a profile already set up, this is another tool that you can download for free on your mobile device as well. This is keeping all of your information in one place. You can view, you'll never have to carry your ID card again. You can view your ID card, you can get medical, you can see your medical claims, you can talk with a live doctor, you can live chat with a doctor, you can view costs, you can schedule appointments. It's an absolutely revolutionary tool. And next we have our special offers tool. This is where we partner with a number of different vendors that you can save money on glasses, weight loss programs, gym membership, vitamins, even pet discounts. And we have also discounts on that, the 23andMe kits, ancestry kits. You would just go on to the www.anthem.com, choose options and discounts, but you must be a registered member to go in there and get the discounts. And lastly, here's all of our customer service numbers that are available to each and every person. I put the Lacers customer service numbers, not that you don't not know those, and then all of our Anthem customer services. We have our the medical customer service, the Part D for the medical RX, and our first impression number for new members, and our website and the hours. And with that, that completes my presentation. If you have any other questions.
Well, I do want to just add again that there is a $25 gift, two $25 gift cards that Anthem is raffling off today for our guests. And just so you know, we're going to base it on whose birthday is closest to today. And instead of having to get everybody to respond and provide your birthdays, we actually can go into our system and look up your birthday. So based on the people that are here today, we will go into our system, check the birthdays, and if two people, and there are two cards, but if more people have the same birthday, the person that is older will get the card. So, you know, there is some value in getting older. So.
And then Alex, if you'll send me the names of those two lucky winners, we will get those emailed directly to them.
Okay, perfect.
Okay, everybody. At this point, thank you so much, Maggie. You went flawless.
Thank you.
We're going to start asking some questions of folks. We're going to start having some folks ask you questions, Maggie, and Alex and Bruce, Stephanie and Crystal. So Stephanie will be giving you the folks to call on, and I will be unmuting you. So let's start with Linda. Let me call on Linda. Can you hear me, Linda? If you can unmute yourself.
Okay, I can hear you, but I couldn't see how to unmute me.
Okay.
Can you?
We can. Please go ahead, Linda.
Is Anthem, I'm considering moving to Arizona. Is Anthem available in Arizona?
Yes, we have the PPO plan. It is available in all states. Yes.
Okay, I know I had another question, but of course I can't remember.
Yeah, and the Medicare supplement plan is also available nationwide.
So I can go to any state and be able to use Anthem?
Correct.
Oh, okay. And Anthem also has PPO and HMO?
The HMO is California only. The PPO. Yeah.
Okay. So I live in Apple Valley, and if I wanted to go to a doctor at UCLA, would I be able to do that?
No, you would, that's out of the zip code for, you have to be in a 30 mile zip code.
Really?
Yeah.
That's kind of interesting because I live further away from Kaiser than that, and that's one of my problems why I want to change, because it's so inconvenient from where I live.
Yeah.
But that would be HMO only. A PPO, would I be able to do that?
Yes, with PPO, yes.
Oh, okay. Okay, that makes sense. Thank you very much. I think that's all my questions, but I'm going to keep listening.
You're welcome.
Our next question is from Jay Tran. I'm going to ask you to unmute yourself, Jay Tran.
Hi, I'm asking these questions for a friend because she couldn't make it today. And you might have just kind of answered a bit. She was saying that, can I select a provider that is associated with UCLA, Cedars-Sinai, or any other hospitals under HMO?
Only if the medical group, you would have to check with the medical group. And if a medical group has those hospitals affiliated with them.
Right, and then the second question, I think the second question you kind of answer it, because she was asking, can she choose an HMO doctor who practices in West LA or Santa Monica, but she lives in Huntington Beach? And I think you said that she can only choose a provider that is within 30-mile radius of her zip code where she lives. Is that the case?
Correct.
I see.
Okay.
And also for us who are in our retirement age where we travel outside of the country, if we run into emergency situations, can we get reimbursed for the care we get outside of the country?
Oh, most definitely, most definitely. We have a blue card worldwide, and I'll send Alex over that brochure to post on the website, because they can help you find doctors and hospitals while you're traveling that will help you get covered. If it's an emergency situation, you would pay up front and then submit a claim form, and we would get you reimbursed.
Thank you so much.
You're welcome.
Thank you. Next up is Roberta Yang. I'm going to ask you to unmute yourself, Roberta.
Good morning. I just need a current phone number for Ingenio RX, your mail order pharmacy.
For the medical side, or the for the under 65 or the over 65?
Actually under 65.
Okay, because you can call the customer service number that's on the line right here, the 866. You can call that number and they can give you the Ingenio number.
Oh, okay.
Yeah, I don't have it handy with me. I apologize. I can get that over to overtime.
No problem. I'll call the 866 number. Thank you.
You're welcome.
Thank you. And next up is Kathy Brown. I'm going to ask you to unmute yourself, Kathy.
Hello?
Yes, hi there, Kathy. Please go
Hi.
ahead.
Hi. Okay, yes, I was wondering, so if we move somewhere, if we choose the PPO and we move somewhere in the country, do they have in-network benefits anywhere as opposed to, you know what I mean? Am I explaining myself right?
Yes, we do. Yes, we do. We have providers in every state.
Okay.
Yeah.
That's what I needed to know. Thank you.
You're welcome.
Thank you so much. Next up, we have Doug. I'm going to ask you to unmute yourself, Doug. Are you with us, Doug? Give Doug one more moment. Doug, if nothing. Okay, so Doug, while we figure that out, we're going to go to Tony Z. Are you with us there, Tony? I'm going to ask you to unmute yourself, Tony. Are you with us, Tony? Okay, next we're going to go. We'll get back to everybody. We're going to go to Nancy Castles. Are you with us, Nancy?
Yes.
Please go ahead, Nancy.
Hi. I have 4 questions that I've added to the chat, and I'll cover them. If we are, does Anthem cover out-of-country costs, or does Anthem provide coverage for dependents not covered by Medicare, in other words, under 65, and they are out of California and or out of the country due to, because they're for graduate studies. There is an out of state or away from home coverage that they have, but I don't know if it covers for out of the country.
If you're on a PPO plan, it would cover for emergencies out of country. If you're traveling in other state, if you're on a PPO, you have the in and out of network benefits. For the guest membership is the program on the HMO, where if it's a student, they would sign up for guest membership, and if it's available in that state, it would be covered.
Okay, so it may not be covered then if they leave the country to go for graduate studies.
Correct.
Okay, and then how Medicare constantly says that they do not cover for out of country medical needs. So how does Anthem provide for this out of country coverage?
We have a PPO plan under Anthem that whether you're of age or Medicare eligible, we do have that PPO plan. So you are covered at, you have the $500 deductible and you're covered at 70% UCR. You have a $10,000 out-of-pocket max. So you are covered.
Okay.
All of those benefits, as Alex had mentioned, all of them are in detail on the lacers.org website.
Okay, thank you. And then here's a question for Crystal regarding the champion programs. If we were to, at one point we were doing walks. Why are the walks no longer why can we not conduct the walks if everyone agrees, if the group stays small and we agree to stay 6 feet away and wear masks?
In actuality, with regards to that, I know that I've spoken with a couple of champions that actually is still doing walks. They're actually doing walks with themselves and maybe 1 or 2 other individuals. I don't know, Alex may want to jump in with that. Long as you keep, our issue in the beginning was the liability factor. When everything first happened, we didn't know how it was spreaded, how it can be transferred to someone else. However, I know based upon what CDC, what their recommendations are, and like I said, that changes constantly every day. It's something different happening because I heard long as you're out in the open, the wind is blowing, you're keeping a distance, you have your mask on outside, then you're okay. But then tomorrow on the news, it may be something else. Alice can chime in on this. I don't see where there would be a problem as long as there was social distancing and you're wearing your mask while you're doing the activity. Alex, Stephanie, you all want to chime in on that?
Yeah, I'll go ahead and say a few words. I think, the thing is our champions are volunteers. We don't necessarily restrict them in what they can do or not do. I mean, initially, as Crystal said, we didn't want to have any type of in-person events. And I know I'm comfortable with the idea of walking in a group outside, keeping some distance and wearing a mask, but if our champions aren't comfortable with that, we're not going to force them to do it. This is sort of a voluntary thing that they're doing, and we want them to feel safe and secure. We want everybody to feel safe and secure. And so if you're interested in starting a walk with a small group, socially distanced, let us know. And we can look into that and trying to set something up. But again, everybody's different. Some people aren't afraid of it at all and don't want to wear a mask. Other people want to hide away and not go outside at all. So, there's a full spectrum.
Yeah, Nancy actually is a new champion. She actually had she actually had just signed up because she was going to do the aviation museum tour for us.
Okay, nice.
And so yeah. So she was going to do that tour for us.
Yeah, and then the Cabrillo Museum,
the Cabrillo Beach Walk.
The two of them, and they both got canceled. So.
Well, awesome. Well, if anybody's out there that thinks they might want to join a small group and do an outdoor walk with social distancing and masks, just go ahead and put your names. Just say you're interested. Put your names in the chat, and we'll make sure you all get together and. Where would you do your walk?
Well, earlier when we had the comment, I went out. I mean, we met. I mean, just a couple people, and I met at Mount Pinion, which is about a 2-hour drive away.
Oh.
We hiked up about 1.5 miles to watch the comet.
Oh, nice.
Wow. And to take pictures of the comet, and everyone was more. I mean, there were only 12 people, and I mean, and there were only 6 of us, right? But we went up there separately. I mean, there was plenty of room. There were only 12 people on that entire mountaintop. Wow. To watch the comet. So it was just those kinds of things maybe, would have been interesting for a lot of other people, just so long as we stay up there on our, and there was plenty of for us all to ensure we stayed apart.
Well, Nancy, send me an email. And because I know we're going to be putting together our wellness calendar on the website where we're going to be posting the virtual activities. And I would want to put your activity back on the calendar so people could reach you if they want to participate. So just send me a personal email.
Okay, so it'll be walks outside because I feel more comfortable walking outside, not the indoor stuff. Okay, thank you.
Thank you, Nancy.
That finishes my questions.
Thank you, Nancy. Next up is Jamila. I'm going to unmute you, Jamila. See if you can see the unmute button. Join video, join audio.
Hello.
Hi, we hear you. Please go ahead, Jamila.
Yeah, I just had a question about the Anthem the Medicare Part D. Who pays that? Is that if I had the Anthem option? Would Part D be covered? Would the Part D be deductible be covered by Anthem?
So when you're speaking about the Part D, instead of the deductible, are you speaking about more of that donut hole when you get to that certain point? You have co-pays. I'll just make it easy for you. You have co-pays throughout your entire Part D plan.
Right.
And so, yeah, there's not a deductible on that.
There's not a deductible. Okay, perfect. Thank you.
Okay, is that all you have for us, Jamila?
That's it. Thank you.
Okay, thank you. The next person we're calling on is Angela. Angela, I'm going to ask to unmute you. Do you hear us, Angela?
Yes. Okay.
Please go ahead.
I joined the PPO since 2016, and I have Part A and B. And every year at the beginning, when I go to see doctor, they charge me like $100 some. So this year I pay like 198. And one of my friends just joined in August. They said she only pay 100. They asked him for $100. So I just wonder, is it that amount is different from everybody or how it works?
Is your friend enrolled in the exact same plan as you, meaning is it a LACERS plan?
Yes, she just turned 65 in August. That's right. And she also have Part A and B.
Is she, okay, so she's enrolled in the Anthem Medicare Supplement plan?
Yes, right.
Alex, I can talk to this because I know that there's a lot of, I'm dealing with this a lot. Oftentimes these doctors that you're seeing don't necessarily understand how the plan works, and what they'll do is they'll charge you for the visit and then expect you to go seek reimbursement after, which technically they're not supposed to do. And oftentimes I have to educate them on the Medicare allowable. Medicare controls your costs. And so please feel free to give us your information, and I can work directly with you on that to make sure I understand and that is the true issue.
Oh, okay.
Yeah.
How can I send the information to you? Just email you or?
Yeah,
I'll
I'll put
privately in the chat, or I don't know, Alex, if you want to take some of the private ones and then send it over to us.
Yeah, you can if you want to put your information just in the to field at the bottom of the chat, just have it go directly to me or to Bruce Bernal, and you can send us the information. We'll forward it.
So what information do I need to provide?
Well, you know what? If you give us your name and your phone number, actually, we'll reach out and we'll call you.
Oh, okay. All right. Yeah. So I just put it on the chat, right?
Yeah.
To Alex.
Okay.
Yeah, to me.
Yeah,
I want everybody to be your new best friend and call you.
Yeah.
All right. It's okay.
Thank you.
And I do want to point out something too. You know, a lot of the times there's a lot of questions throughout the year about, you know, why you're receiving certain bills, or, you know, what is the service covered or not. And if you have any question about the service you're receiving or the bills you're receiving, please reach out to LACERS. We have staff that are there to help you, and we work with Anthem to resolve any issues. I will say, for the next few months, because we are so overwhelmed retiring all these people from the city, that these types of calls are going to get directed directly to the carrier, to Anthem. But, you know, definitely we're always here to help as well.
Thank you. And next up is Linda Wilson. I'm going to unmute you, Linda. Are you with us, Linda? All right. So we have.
Are you there?
Yes. Hello, Linda. Please go ahead.
Yes. Oh, I was just wondering what the deductible is from Medicare and Blue Cross. Once you meet that threshold, then they start paying. What is the amount for the annual deduction?
Are you talking on the Med Sup plan?
No, for doctors and that. So if I go to the doctor in that first time of the year, how much is the deductible that I have to pay for doctor's visits?
Yeah, the Part D deductible, Part B deductible for the Med Sup plan. Each plan has a different deductible, whether you're under 65 or whichever plan you're on. But for the retired age 65 and older, it would be the Medicare Part B deductible.
And how much is that?
I believe that's $300, right? I think it's $300. We can definitely check that, but I'm almost 99% sure it's $300.
Yeah, it changes each year, and we don't always have that information when we print the guide. So that's why we just put a standard Part B deductible, but that sounds right, Maggie. It's around that amount.
Mm-hmm.
Okay, thank you.
You're welcome.
Thank you very much. And then we have Linda Kay with a question. Unmuting you, Linda Kay. Are you with us? All right, then we're going to go to Linda Thomas. Are you with us?
Yes, I am.
Oh, please go right ahead.
I had a question about the nurse line, the 24/7 nurse line.
Uh-huh.
I'm in Decatur, Georgia. So how do you said this is a 24/7 nurse line?
Correct. It's 24/7, 7 days a week, 365 a year. Are you an Anthem member now?
Yes, I am.
The number is on
Maggie, I put the phone number in for her on the chat box, but now I'm trying to find it.
Oh,
okay. And
The
then Linda,
is it
it's also on your back of your ID card as well.
Oh, okay. All right, great. Thank you.
You're welcome.
We have another question from 1+6. It's a device. I think it could be a tablet or a phone.
Modern technology.
Modern technology. We don't see your name. If you hear us, you can unmute yourself. I'm going to ask you, are you there? I think you
Is that my turn?
That is you. We hear you. Please go ahead with your question and tell us your name.
Z.
Hi, Z. Please go ahead with your questions.
My understanding, you mentioned about the donut. Is that the for part D, like a David?
Tammy?
Can you hear me?
It's part B for boy. The part B, did you say? Oh, the donut hole. Sorry, that's part D. Yeah, like drug. Yeah.
Uh-huh.
But you know,
Tammy, you're on. Yeah, Tammy, you're on mute.
But I will say that the donut hole is not an issue in Lacer's plans. You have coverage through the donut hole, so nothing changes for you.
Yeah,
I see.
That's why you have okay.
Also, if I enrolled in the Medicare Blue Cross Anthem Blue Cross plan, just the one enrollment, including the part D, as in David.
Mm-hmm.
I don't need to do two enrollment, correct?
Well, they need the part D, the manual and open enrollment form, right?
Yeah. I was going to say that's I was going to say, the part D is automatically integrated into all of our senior plans. So yeah, you wouldn't do a separate enrollment for part D. It's automatically integrated in every one of our senior plans. So yeah, you don't have to enroll in that.
Okay, and the last question, I see there's a acupuncture or chiropractor coverage, and it's mentioned UCR because Medicaid does not cover acupuncture or chiropractor, so that the portion has a $10 copay. Do I make a $10 copay when initially I have to meet the deductible?
No, when you go for your visits, you pay the $10 copay.
Yes, let's say for the first visit of the new year, I have not met deductible yet. So let's say doctor visit is $100, and in order to meet the deductible, so the $100 is my responsibility. But do I still have to pay $10 copay on top of that for acupuncture, for example?
No, so you would pay the Medicare
Acupuncture
allowable.
isn't. Yeah. I don't think the deductible is applicable with the copay. But
So what you would do, your doctor would charge, let's say your doctor charges $100, but Medicare only allows $80. You will be responsible for $80, not that extra $10. It's once you hit that deductible that the copays now will be your payment. Does that make sense?
And does that include chiropractic or acupuncture as well, or is that separate from the deductible?
But it
It's for-
should be the same.
Yeah, it's for both
It's
Cairo and
yeah. Yeah.
So my question is, at the what point I started paying the $10 deductible, the copay, whether I met deductible or not?
correct. For after your deductible's been met, then it will just be the $10 copay for each visit.
Yeah, but before meeting the deductible, do I still have to pay $10 copay?
No,
No, it's
your deductible. You meet your deductible first.
Yeah, you have to pay the amount that Medicare charges or allows to be charged for that service. And once you hit, I looked up the Part B deductible, and for 2020, it's $198. I don't see anything for 2021 yet, but it does show that it's probably going to increase. So once you pay that amount out of pocket for any services that you received, then the copays will kick in. Is that correct?
Yeah, that's correct. Thank you,
Okay.
Alex. Thank you. Thank you.
Because yeah, because I called the lasers and I was give answer in the example I'm giving, says I needed to pay that $100 to meet the deductible, and also as well as pay $10 copay. And that's not the case. That's what I was told over the phone.
Yeah, no, you meet your deductible first.
Okay, so I don't pay two at the same time, meeting the
No.
deductible and the copay.
No.
I only pay
No.
copay when I after make the deductible.
Correct. Correct.
Now the Medicare does not cover acupuncture. So that means if not cover, that $100, it's not even meet the deductible. It only counts the deductible when it's approved, cover the service.
Medicare does cover acupuncture.
Oh, it does?
It's new. So chiropractor and acupuncture are covered. Yes, yeah, I know, it's exciting.
Oh, it's something new for 2021?
Yes,
Yes,
for
it is.
2021, yes.
Cover acupuncture and the chiropractor?
Yes. So there's going to be Medicare allowables, and the acupuncture should know what's allowed by Medicare. Mm-hmm.
Oh, so then in the booklet, it's that's exciting. So let's say Medicare approved for 80% for the in-network, right? We're talking about PPO in-network 80%, and then then also cover whatever UCR. And it's mentioned about 70%. The 70% is being covered, or 70% being my responsibility?
The 70% is when you go out and network. So as long as you're in network, you have the higher benefits. So
yeah,
if you
so
go
let's...
Yeah, but the plan will cover the 70%, and you will
cover the 30. Yeah.
Okay, that's also a little confusing. When I called the laser, I think it's just because something new, and I was told I will pay 70% because Medicare does not cover. I said, oh, so you clarified it's something new covered by Medicare. The 70% is, let's say, go back to the example I mentioned, $100, and I did not meet the deductible. So if out of the network, so if the doctor, the UCR means, the doctor cannot charge you whatever she or he wants to. So let's say the $100 is not UCR. Let's say it's a reason, the reasonable. So 70% is $70, and I will be responsible for $30, and then the $70, the $100 whole thing will be used for deductible. Am I correct?
Yeah. Yeah.
Yeah.
Yes.
I see. Okay.
No.
Yeah, I think, Alex, let's get her name and then I can chat with her.
Thank you.
Thank you.
Yeah, if you wouldn't mind, just go ahead and type your name and phone number in the chat. Send it to me or Bruce Bernal, and we'll get that to Anthem so they can reach you directly.
Yeah.
Thank you.
Yes.
We have another
Thank you.
question. And we're going to call on you, Kay. Kay, I'm going to unmute you right now. Kay Ebleth. Do you hear us?
Okay, are we there?
Yes, Kay, please go ahead.
Okay, I've been with Kaiser for over 50 years and I'm moving to Arizona. And so Anthem Blue Cross is like the primary one that I'm interested in, but I want to know if I can actually find out which doctors are in the Arizona area before I actually make my move. And I want to know whether the Kaiser prescriptions that I currently have would be covered by Anthem Blue Cross if a doctor in Arizona under Anthem prescribed them.
Okay, so for moving to Arizona from Kaiser, you would go on the anthem.com website and you would sign in as a guest and you could put in the zip code to find participating providers in the area. Sometimes what I like to do is if you have relatives or you have friends or people that live out there, I like getting recommendations from other people. But more than happy to, if you wanted to call us, you could give your name again to Alex. I can walk you through the website. We can do a little webinar and we can share screens and I can walk you through the website, but you can log on as a guest, put in your zip code and pull up any type of doctor that you'd like. As far as your prescriptions, the best bet to do is before you move over to another plan is to get them all filled before the end of the year so that you don't run out. And then once you get your new provider will prescribe new prescriptions for you.
But if they do prescribe the prescriptions I'm currently taking, will Anthem Blue Cross be covering them?
We would have to know what they are, but I wouldn't see why not. But we would have to know what they currently are. Again, if you give Alex your name, he can give your name to me, and then I'll look them up for you and make sure that they are covered.
Yeah, and are you over 65 years old?
Oh yes, I'm over 65. I have Medicare A and B.
Okay.
And I've been, as I said, I've been with Kaiser for well over 50 years. So that's why.
So what I wanted to say is our Medicare plans, they integrate Medicare Part D, and there's a Medicare Part D formulary that they cover. So there's a lot of consistency. I mean, they should be pretty similar. Each Medicare plan uses the formulary, so the list of drugs that are approved by Medicare Part D. There may be some that are outstanding that aren't necessarily covered by one plan or another, but if it's in the Part D formulary, it's going to be in each of the plans.
So if I send my name and email, somebody can contact me?
Yeah, absolutely.
And I send it to you, Alex?
That's fine. Yeah, you can.
Can I do it right over the chat thing here?
Yes, you can.
Okay, great.
And then too, we also have the Part D first impressions number that you can call as well. If you wanted to discuss all of your medications with them, they can look it up right there on the spot for you as well.
Is that the 646-2436 number?
I believe so. Was that, I don't know where my screen went and it went down.
Is that one?
Yeah.
Yes, that's the one.
Okay.
That's Part D. Yep.
Yeah.
That's it.
And also for your website, I know it's /CA. Is that the same one I would go to even though I'm concerned about Arizona?
Correct.
Okay. All right.
Correct. Yeah, because you would put in a zip code for Arizona.
Okay.
Any state.
Okay, I'm going to send my email to Alex. Thank you very much.
Perfect.
You're welcome.
Thank you. We have had a hand up for a while from Faye Chu. I'm going to ask you to unmute Faye, if you're with us. Are you with us, Faye?
Yes. Did you hear me?
I can. Please go ahead, Faye.
Okay. I've been a member of Anthem PPO for several years, and I've noticed that they have been sending for the past several years extended drug coverage. Okay, I'm under Medicare. And there's no explanation of how to access this extended drug coverage. Is basically getting over-the-counter vitamins and getting anything that's over-the-counter that's in their lists. And I called Anthem, and they don't have a clue about it. And I just want to know, how do you access that benefit?
Okay, this is Tammy Rowe. And what you will do, and I'll definitely take that feedback back to our customer service center, and I really do apologize for that. But you still need a prescription from your doctor, and this kind of prevents you buying cold medication for other people, and it just allows us to keep track of that. So you would still, even though it's over the counter, your doctor can give you a prescription, and you can either fill that at the pharmacy, or with a prescription, you can also purchase it over the counter and then submit a claim reimbursement form with your receipt.
Okay, that's clear then, because generally my doctor says it's over the counter, and I'm like, and then I see this thing, so I have no idea. He doesn't give me a prescription. It's like, how do you access this thing?
Yeah, yeah.
Okay, thank you. Up next is Mark Medovsky. Do you hear us, Mark?
Me?
Yes, Mark, please go right ahead.
So I have a question about the timing of doing a family status change in the middle of the year. My wife is going to be added to my plan. Right now, she has coverage through her job, but she's going to be retiring and going on Part B, which she doesn't have yet. So she would have to first get onto Part B for some period of time before she can come onto the Lacers plan. And if so, when do we actually put in the application to get her on the Lacers plan, so there's not a gap in coverage?
Okay, I'm sorry. So your wife is going to be terminating her coverage and moving on to your plan, right?
Right.
And did you say she has to enroll in Medicare Part B?
She doesn't have Part B now because she gets that coverage through her job.
Okay, so she's going to have, and she is 65 or older.
She will be when she retires, yeah.
Oh, okay, so yeah, so what will happen is she should go to Medicare, to Social Security. I guess you have to do it online now, and enroll in Medicare Part B. And if she has been paying into Medicare over the years and has 40 quarters or 10 years of paying Medicare taxes, then she'll be eligible for Part A as well. And so
she already has Part A.
Oh, she does. Okay, great. So then, perfect. Yeah. So then she just needs to enroll in Part B, and then if she's able to have all that together by the time she retires, we will be able to get her into your plan. We typically want people, we have a window of 30 days from being involuntarily terminated. So the thing is, you can always work with Lacers. If there's an issue in getting the Medicare Part B right away, we'll work with you. We'll keep her, we'll figure something out. We either keep them in the non-Medicare plan, or because she has Part A, we'll figure something out. But what would make it easiest is if she's able to get that within 30 days of being terminated from her plan, and then we can enroll. But yeah, definitely, probably, I would say a couple months before retiring, she should contact Social Security.
But Lacers needs about a month to process her application to join my plan then.
Yeah, that's right. Because we have to get, we want to make sure everything is correct. When we have, proof of Medicare and the form is filled out completely, we'll go ahead and submit that like mid-month to the, to maybe 3/4 of the way down into the month for an effective date of the first of the following month.
Okay, thank you.
That makes sense? Okay.
Thank you.
Thank you. Next, we have Angela Young. Do you hear us, Angela? Are you with us, Angela? See if you can unmute. Okay, we can't hear Angela. If you can find it, you take a moment over here. And next we are going to move on to, it looks like we're pretty caught up, folks. If there's any questions that were missed, then Stephanie, Crystal, and Alex will address this. Oh, we have iPad 7438. Can you unmute yourself? I see your hand up. Your name is not listed, so I'll ask you to.
Okay.
Please go right ahead. We got you.
Okay. If I am over 65 and I have Medicare and the PPO Anthem, what do I tell the doctor office? Is Medicare my primary or Anthem my primary?
Well, Medicare is, well, it's the Medicare supplement plan with Medicare Parts A and B.
Correct.
Yeah, so Medicare is the primary, and so they will, bill Medicare, and then typically Medicare covers about 80% of the cost, and then Anthem will pick up the balance as long as it's in network and they accept Medicare. Well, as long as they accept Medicare. If they don't accept Medicare, there's a whole slew of issues and problems, but I don't know if you want to add anything to that, Tammy or Maggie.
Yeah, no, that is correct. Medicare pays first and then Anthem would pay secondary.
Okay. And then when I will be filling in the forms now for the Anthem, I also want the Delta for the dental and I want the Anthem View. Do I fill up everything at once or do I have to fill up 3 different forms?
For Anthem Blue View, that's included with your medical. So when you enroll in a LACER's medical plan, other than Kaiser, Anthem Blue View is included. Kaiser has its own vision benefits. Dental, Bruce, it's all on one form, right? All on one enrollment form. I haven't looked at one in so long.
I think
yes, all on one form, correct.
It's all on one form.
Yeah.
Okay, so I will have to mark that I want the dental and I want the view.
Yeah, well, the Blue View will be added automatically when you enroll in Anthem.
Yeah.
Okay, very good. Thank you so much.
But we're going to close up with John Lynch. John, I'm going to unmute you. Please look for your unmute button, join video audio.
Hi, can you hear me?
Yes, sir. Please go ahead.
Okay, so this is kind of a general question and it's got a lot of variables, I know, but I have Medicare A and B with Kaiser. And I know that if I, for example, had some medical emergency and got rushed to the hospital in an ambulance and got admitted and had an operation that say cost, $100,000, I wouldn't owe one thin dime to Kaiser. But if I had Anthem PPO and this scenario occurred, what would be the difference in what I would owe?
So you're talking if you had an emergency.
If I had an emergency and got rushed to the hospital and had some kind of an operation at Kaiser, I wouldn't owe a dime.
Right.
How would that work out with Anthem?
Well, depending on what plan you're in, you're in the your A and B.
Yes.
Okay, so you would be Medicare would be prime,
Mm-hmm.
and then whatever Medicare didn't pick up, Anthem would pick up.
Exactly like Kaiser, 100%.
Pretty much correct.
Okay, well, when you say pretty much, what does that mean? In other words, if some medical procedure occurred in the hospital from a specialist or a doctor that wasn't with Anthem, then would I be dinged for that amount of money, or how would one know? Because everything that Kaiser does, is covered, but you don't have that. I don't think you have that same kind of an assurance with something that might be done, say, at Cedars-Sinai.
Yeah, it would be based on how the plan is. So we would have to look at the benefits under the plan as to which, which category it fell under.
What do you mean? What category? If you've got Anthem PPO, that's the plan, right?
Correct.
Well, then what, I don't understand what you're talking about based on what kind of.
If there was other services within the hospital that needed to be covered, it depended on how the doctor would bill it. We would look at how the doctor billed the services.
I see.
But you're talking about emergency services, correct, John?
Well, I'm talking about, yeah, anything that I go to Kaiser for, any kind of a, procedure, operation, whatever, it's covered. I know it's covered. But with Anthem, I don't know that would be the same.
Well, I just want to interject something here, John, because when you go to Kaiser, even if it's a Kaiser if you go through Kaiser with an emergency, there is a co-payment, but it's waived if you're admitted into the hospital with Kaiser.
Right.
Now, with Anthem Blue Cross, as she stated, I think some of the people answered the question earlier, there's that Part B deductible that you pay.
Mm-hmm.
Even if you have A and B of Medicare, the deductible, and Alex stated for this year is $198. So you're going to pay, the deductible part has to be met, that $198. So if I'm understanding you correctly, because Medicare is your primary payer, at 80%, Anthem covers 20%, but that $198 has to be paid. That's the deductible amount. So I'm trying to figure out if you're trying to see if there's going to be charges outside of the deductible.
Yes.
See, that's what he's trying to figure out there, Maggie, because the deductible amount, from my perception, is what all you would be billed for later is $198, which is the deductible amount, but something outside of that, I'm not sure.
Right.
Yeah, no, that you're absolutely correct, Crystal. That you explained it a lot better. Yeah, that's absolutely correct.
Okay, then the second question I had is regarding your medical records. I know with Kaiser, every doctor you see in the Kaiser family has access to your medical records. Who has access to your medical records if you were with Anthem and say, for example, you were traveling and had an emergency in Texas and had to go to a doctor? How would that doctor be able to access a central database of your records?
Not all doctors have the ability, the electronic ability. The majority of them do. It would depend on the facility or the provider.
I think also what I would want to say is that, with Kaiser, it's really mostly California based. They don't have many facilities outside of California. So if you were in Texas, for instance, and something happened, there wouldn't be a Kaiser facility you could go to. So they'd have to contact Kaiser, your doctor. And I think
no. You're that's not what I'm asking. I'm saying if I switched now to Anthem,
right,
and had some relationship with a doctor here in California,
right,
say at Cedars, and then 2 years from now, I moved to Texas, or 2 years from now, I'm traveling in Texas and had an emergency.
Right.
That's what, would that doctor be able to access records that this Cedars-Sinai doctor has been keeping from me?
Right, and that's what I was getting to. I think that doctor in Texas that's treating you would have to contact your Anthem doctor. Same as with Kaiser, right? They don't have access to your information immediately, but if they contact your medical provider, then they will be able to work with them.
Yeah, that's correct.
And Alex, to go off of that, we do have my family medical record. So it's not your entire medical records per se. However, any tests you did under Anthem, it is all listed in there. So it's like a mini medical record. So you can go on there and it's all of your Anthem history that goes with you. So even if they can't do it, you have access to that.
Okay. All right. Thank you very much. I appreciate it.
Truly, this has been a very informative open enrollment event. And, you know, my health advocate, because a lot of you I've dealt with in the past, and so that kicked in with the questions started coming. But we do have, you know, we've been sitting now for over an hour. And so it's time to get moving a little bit. And even as Maggie said, they do have, Silver Sneakers is offering virtual exercise classes now that we can all take part in. I believe that we may have already put the link in the chat. But at this time, I'm going to turn it over as Elijah queue it up for a 4-minute Silver Sneakers exercise video.
Yeah, and just so everybody knows, Anthem, all Anthem plans have Silver Sneakers, free gym membership and resources available. So please use that.
Okay, so get up out your seats and let's get moving if you have room.
Regular exercise is beneficial to both your body and your brain. The benefits of exercise on memory are even greater when your workout includes a mix of resistance training with cardiovascular training. So I've put together a great little combination that adds a little bit of strength, a little bit of cardio, definitely some coordination, even some balance. The Brain Boost is taking the time to learn the combination. So let's be patient with ourselves as we practice this new drill. Let's start with our feet a comfortable distance apart, and we'll just do some knee lifts. Right side, left side, 2 more. You choose how high the knee lifts are. Then I want 3 in a row on the right. 3, 2, and 1. Anchor your feet down, sit back in a gentle squat, keep your chest up, squeeze your glutes, come up nice and tall. Let's do the other side. Left, whoa, right, that's it. Left and right. 3 knees in a row on the left side. 3, 2, 1. Both feet down, sit back and stand tall. Let's practice the upper body. Right elbow comes up, it stays there. Left elbow comes up, it stays there. Both elbows down, up, down, up. Now the right elbow comes down, it stays there. The left elbow comes down, it stays there. Up, down, up, down. Let's just practice on the left. Lift, lift, down, up, up. Then left side, down, down, up, down, up, down. All right, let's see if we can put those together. So the right knee comes up and the right elbow comes up, but the right elbow stays. Left elbow, left knee, but the left elbow stays. Then together, down, up, up. Then the right elbow comes down, it stays. The left elbow comes down, it stays. Together, up, down, up, down. 3 knees in a row on the right. 3, you can even add a little rotation if you want to. Set your feet, sit back in a gentle squat, and stand tall. All right, let's do the other side. Keep your left elbow up, your right elbow up, then put it together. Down, up, up. Then left elbow down, it stays, and right stays, down, up. 3 knees in a row on the left. 3, 2, 1. Both feet down, sit into a gentle squat, and stand. How'd you do? You want to practice it one more time? I knew you'd say yes. All right, so here we go. Right, left, together. Right elbow down, it stays. Whoops, I didn't do it. Then the left, then together. Up, down, 3 knees on the right. 3, 2, and 1. A gentle squat. And come up nice and tall. All right, let's see if we do better on the left. I know you did better than me. Here we go. Left stays up, right stays up. Put them together. Down, up, up. Now left comes down, it stays there. And the right, it stays there. Up, down, 3 knees in a row on the left. Both feet down. Sit back into a gentle squat. Weights in your heels. And then squeeze your glutes, come up nice and tall. Excellent job. Practice this coordination drill with me regularly to help boost your brain power and your memory. And when you master it, don't forget to join me again for another challenge.
It's been so beautiful seeing all of you all's faces here today. I hope that you got a lot out of this virtual open enrollment event today. We want to give it up to Alex for putting this on, Bruce Bernal, Stephanie Smith, Maggie from Anthem and their team, for helping us with putting this on, providing the virtual gift cards. And so I hope each and every one of you take advantage of your 2021 benefits. I'm sure you got your health benefits guide packages. So look into what we have to offer. Join the Wellness Champion team. We need you on our team. Anything that you like to do, please go online to the Lacers website, fill out the form to become a champion. So we look forward to seeing you at the next virtual event. See you later. God bless.